rotate up, and we want to think about creating space. Probably sit. Swing the leg around. Look at this little foot, and we think of a bunion having a little kick, right? So, review for anybody that's watching. Had anterior hip pain, but then any foam rolled back here, and the pain got worse in front, correct? More or less. Yeah. Lay on your stomach here, man. So there's a little branch, more a cutaneous branch of the femoral nerve that's going to wrap down around kind of the cleft of the glute. So any pain or discomfort, hold that leg up. I'm going to let go. Still good?
Yeah.
Cool.
I will say it also hurt trying to do like quad cobras or glute bridges.
So going into just
or split squat.
Yeah.
And that was even like out here some.
Like tight.
Mm-hmm.
Yeah.
I was like, well, at least it's not the right side.
Yeah. Pretty wound up. Lay on your side facing me. So we're just gonna kind of see how everything's moving. And have you been running more?
Yeah, I got, it's not like a dramatic mileage per week increase, only like 2 miles a week.
Yeah.
But I did 10 miles Saturday, and I haven't done that since I was like 16. So
Seriously?
yeah. So that felt really good. I think I'm supposed to, my plan, I'll have 11 in a few weeks, and then 12 like the first week that I'm in Missouri.
Scoot your hips back on the table a bit.
The goal is a half in like October,
Okay.
but we'll see.
Especially
Start
relax on me there.
Roommate asked me if I wanted to do a trail marathon with him. I was like,
Who did?
my roommate. I was like, a full marathon? He's like, yeah. I said, like, I'm not in that kind of shape, bud.
It's basically just kind of feeling for, let that relax. Trigger points where lateral femoral, cutaneous, and just femoral nerve would traverse in the cutaneous branches. Because we've seen referral both ways, like stuff happens up here, you get referral down into that kind of ischial tuberosity area, and then vice versa. And we always got to remember that like nerves have anterior grade and retrograde axonal transmission, and like they can send stuff both ways, so it doesn't matter where something's happening. And then all we're really doing here is like positional release. Have you been foam rolling and stuff?
Yeah, the only thing I haven't foam rolled is my hamstring.
Yeah. Okay, so now you're gonna try to lift into me. Ooh, back it down, Hercules. So keep those feet together and just do like a clamshell action. And you can lift, just, back down. And lift. Back down. Lift. Back down. Lift. Back down. Lift. Back down. Cool. So we're gonna do
That's by a river. Or stand his face.
That's pretty much anywhere in Louisiana, man.
Yeah.
A lake or a river.
I think it's in
Small.
West. I think it's in West Louisiana.
So hang tight up here. Lower body chills. Then going back for a sec.
I will say it's felt a little more tight today.
Your foot?
Yeah, that ankle.
Yeah. Does feel like the left.
It's been pretty good lately.
Let's work on that just a tiny bit while we're here. So lay on this side, facing that way. Then bring this foot back, so it's right off the edge. Bridge, I'm having you come over here. So you're gonna help me, Ox, hold that knee down, right? So this knee's getting pinned. Scoop this foot back back a little bit. So we're gonna flex, pin, and then we're just gonna try to roll your ankle. Now is that okay pressure-wise?
Mm-hmm. Been trying to do that one where you're in like the low oblique sit position. And trying to keep that everted.
So just working eversion, kind of a mulligan move here. And then we'll kind of hang on it. Sometimes we'll use a speeder board, sometimes just moving it works. Okay, and then you're gonna lay on your side facing the wall, side lying. So we're gonna go leg here, leg back, scooch back towards the edge of the table.
This
More,
edge?
my edge. Yep, it's a good question. And
You did say back.
let this chill. So rotate a little bit forward. Pull ribs down, head's gonna chill, just like that. So a little bit of push down to the table. Yep. I'm gonna help you feel what you wanna feel right there. Don't let me push forward. So pretty basic 5-month side lying position. Getting him to drive some force through that lateral glute. Without his TFL doing too much. So I'm trying to let me win for a second, Alex. So I'm trying to do that. He's just not letting me win. Common faults would be he's gonna flare his ribs out this way. So pop your ribs. Yep. Back. Or he just can't get his leg down. Yeah. So we're just creating that space. Now try to let this guy relax. There you go. You feel that glute, can't you? Ooh. Shake
Yeah, a
it.
little bit.
No pain.
Mm-hmm.
And then I may try to pose them a little bit. And sometimes we'll even create a little more approximation of the joint. Drawing it in. So now let yourself roll forward a little bit and then resist from there. Roll a little more forward. Push. This is why I always start with mobilization and adjusting first, because when moving so hot around that, like lumbar spine, SI on that side, so then as we start rotating him forward, we're going to need more of those SI and lumbar mechanics to help us out here. Otherwise, we're just going to keep rationing through the hip. Roll forward as much as you can, and then push back, and now actively push back, so try to open up. And then roll back forward, roll back, back forward, 2 more, roll back, back forward, 1 more, and relax. And then go back on your back. Hold right there, following wind. Nothing. Nothing. And then just hold. Follow me in. Good? Good. Little pop. Yeah. Don't let me pull. Doing okay?
Yeah, that's good. There's a little, there's pain there.
On the inside?
Yeah.
Okay. Grab some cups. Yeah. And just little movements. So think a lot less torso, a lot more hip bump. Yep, exactly.
Definitely feels tight outside.
And I know for people watching again, this is not nerve flossing, this is a tensioner. Some of my colleagues that like to be little smart asses, I love you, thanks for keeping me honest, but adding tension is kind of what I would go to first on here, because we didn't have any pain or reproduction to discomfort with active or passive hip extension. Okay, so now I'm going to slap some of these on, so hold. back. All right, keep going. So now just trying to go after superficial branches of some of the femoral nerve, even some of the lumbar nerve rootlets. That's that spot. Yeah. Now stay pushed. Pump your hip forward. So just bump forward and back. Doing okay?
Mm-hmm.
Feeling it in there though? I think we just got wound up. 2 more. So this is dermal traction by Philip Snell, and oh my gosh, I'm blanking on his name. Well, I think Justin Dean. Yeah. All right, so try that one leg hop again.
Yeah, that still hurts.
Okay, same, better, worse, like identical.
Maybe a little better.
Same, neutral. So you don't have to open way up. So just neutral. So bring that knee way down. There you go. Rotate back. Keep that knee neutral. And then set your hip down every time. So sit down, come back up. There you go.
There's a little pain to begin with.
On the initial up, yeah.
But it's not like.
So now we're getting into using that lateral glute complex. That's where we're getting some like pain, and what you're having to, I think what you're getting pain with when you jump is trying to catch your hip from going off the side. So we need to work into that stiffness, which we're going to do with a couple different things here.
Is that similar to, like on this side, and you were saying how my leg wanted to.
Externally rotate, yeah, which you really like to do at key time. 2 more here, and then we're going to take this up to the wall. So again, we're working basically a closed chain, contralateral pattern for hip internal rotation is what we're going after here. And also to eccentrically load the glute. So when he's there, he's going to tell you he feels a little bit of stretch in his glute, but it's like a work stretch, right? So that thing's wound up. And we're going to replicate that up here. So with a diagonal single leg deadlift, just like that. And you're thinking a little more knee push. Yes, sir. Now do you feel that kind of wind up?
A little bit, yeah.
Cool. Good. Keep rolling. I see Alex is wearing a Logan shirt. Alex is getting ready to go to Logan here pretty soon.
Seth came over last night. Talked about.
Nice. We got a preceptor starting from Logan here for
really?
September 1st. Good. One more. Cool. Let's get some jumping. Single leg jump.
Still there.
Got an idea what's going on from a diagnostic standpoint, but then you got to use whatever. It doesn't matter the movement, right? We could do an SFMA or something like that, but like he's not having pain with anything, but specifically that. And then we wonder, okay, what is it about that? I think it's his inability right now to catch that lateral progression in the coronal plane, and that's his fix for that is winding this up really tight so it's stuck in a kind of concentric pattern, and then he's clenching down that femoral nerve and getting kind of front to back pain here. So now I don't want you to try it first, but you need balance, support, single leg deadlift, open all the way, close all the way. Do a couple like that. If that's okay, we'll have to leave. If you need something balanced, we'll do come over. Oh, I can do okay. So no weight to start with. So hinge. Try to open your hip to the camera. Close it down. Yeah. So I want the right hand to hit the foam roller as you hinge down. So hand goes on, open, close. Yep. Hand on barely. Open. Close. And make your hip do the work, not your torso. And back up. Yeah. And you can take a little bit of lean out of it. So 45 degrees. Open. Close. Back up. A little bit. Yep. Use your hand. Open. And it's not necessarily his ability to get into internal rotation, it's to control it dynamically. So can you see in the video, it's still pretty flat. Now, he doesn't have an internal rotation deficit per se, just doesn't like to go there. There you go, yeah. That's what we're gonna try to replicate, right? So the up is good. You gotta go in there. Now Is there any pain or discomfort with that? Just tight. Where do you feel the tightness? Front of your hip or in your lateral glute?
I can feel like the medial part feels like that's trying to
Do
work.
something. Yeah.
And then this part feels tight.
And that's what we were doing in that 5-month sideline position there. Is trying to pull his hip into a better centrated position so he can start to move through there. And sometimes with a movement like this, keep going, it's better to apply resistance so you can actually feel what we're trying to get. And if you can come over top of your Bridget, here's a very common thing, so I'm going to be looking right down over here, is as he goes, we're going to see that he goes into lateral flexion. So we're going to find a way to do it, and you can see how this can start to mess with spinal mechanics here. Again, hence why we adjust and mobilize first, and I'm not really going to coach him out of that per se. So that's the feel, okay? So come on back up. Really, let's just use the back. I want you solid. Now just hang on and do exactly what you're doing. Back and forth. And just open and close. All the way on the close. There you go. Hey. Perfect. And do 5 more, and we'll do some little jumps. See what we're feeling. Support. Just try to go there and see if it's as shaky as the left. And then close it down. Yeah. So what we also haven't said in this visit is what were we dealing with prior? Anterior hip pain on this side, foot pain. So Alex really likes to get stuck in this kind of a position, runner. And when we get stuck like that, you can imagine how much stress is going to be put through the outside, and how much he doesn't like to actually go through hip internal rotation extension. Just likes to live out here and kind of like this John Wayne cowboy look. So one more support. So at home, he's gonna do assisted, like a door frame, and he's gonna play around with taking his foam roller, hinging to that, barely using it, and then we're gonna try to work to where we can do this in open space, and then we hope by that time we got better input and better control